We take it to the national capital now, where doctors at the Maulana Azad Medical College, which includes LNJP Hospital, have called for a strike. This after a doctor in the emergency ward of LNJP was assaulted by the patient's skin last night. The doctors will soon be meeting the administration to demand safety at the workplace. Okay, so this is what has transpired now ever since this strike that's been called by the doctors. This is after yet again another incident where the patient's skin allegedly beat up one of the doctors who was on duty at the emergency ward. Following which we are seeing now the doctors go on a strike. So the Maulana Azad Medical College in the national capital. Now, this also includes the LNJP hospital, to which it's tied. The doctors are demanding safety at the workplace. We saw similar protests, remember, take place last year, where in fact doctors had gone on strike. That was a nationwide strike that was called following the assault on a doctor in Bengal. Another assault on another doctor, this time in the national capital, has brought in fact doctors at the Maulana Azad Medical College onto the streets to try and make their point, once again highlighting how unsafe doctors are being beaten up, targeted by the kin of patients. My colleague Ayushman Kumar will be joining us on the phone line with the details of this story from the national capital and how it impacts the people of the capital. Ayushman, can you tell us what the current situation is? The strike has certainly been called, but how is it affecting, first of all, which hospitals is this affecting, and how is this affecting patients at these hospitals?
Well, this is a strike call given by the resident doctor from the Maulana Azad Medical College. This college has sent the resident doctors to 4 of the hospitals, which includes the GB Pant Hospital, LNJP, Loknayak Jayaprakash Hospital. There is a Susut Trauma Center, and at the same time there is a eye hospital where these doctors go. All these 4 hospitals have got a strike by the resident doctors. The worst part is that the emergency services, which normally functions during the resident doctor strike, this time they have even decided that they won't be working in the emergency services because the doctor was last night attacked in the emergency services itself. Right now, we know that the MS of the LNJP hospital, along with a delegation of the resident doctors, have come to the health secretary of Delhi, and they are meeting him, and they have apprised him of the situation and have said that there are basic 3 demands. First is the deployment of marshals, second is the installation of CCTV camera, and third is of increase of the number of paramedical staff in the hospital. We are being told by these sources that even the Delhi Delhi Health Secretary said that he was not of the view that these hospitals have been, the marshals which were deployed earlier, they have been removed. He said that immediately he would be giving the orders for redeployment of the marshals in the hospitals. Though other 2 demands will be taking time, but for now it is being said that definitely very soon we will see the doctors calling off their strike, but right now the strike continues.
Right, and Ayushman, just once again to reiterate here, so it's emergency services that have been hit, but what other departments have been hit? What departments are then functioning in these hospitals if the emergency is not being taken care of by the resident doctors?
Well, there are several patients coming from the western part of Uttar Pradesh and in fact from Delhi. They complained that there is nobody in the emergency services right now, but we were told by the hospital officials that certain professors, senior professors are already attending the patients, but clearly services at LNJP hospital has been affected because of this doctor strike. There are several patients who are saying that they have been told to return because we are being told that over 1,000 patients come every day on the emergency in the emergency department, and there are only 6 to 7 professors right now. So currently the burden is huge on the doctors resident. That is why many of them are being told to return back because the emergency services have been hit. So in totality, every hospital ward and every department has been affected because of the resident doctors strike. Viren.
Right, Ayushman, stay with us because we've heard from some of the patients. We've also heard from some of these doctors who are on strike. Listen to what they had to say.
The core demand is only safe working environment in emergency and OPD services will be resumed only after employment of security guards, marshals, permanent marshals, because last time a strike was done and only permanent marshals was employed for 1 or 2 months, then they have gone. I don't know what happened to them because services are not continued by government, or same incident is happening again and again. In last weeks there are 3 incidents, and yesterday there is an incident in emergency medicine department. We are not keen to stop the emergency services, but repeatedly same incident is happening again and again.
In the emergency department, one patient came and the emergency team tried to revive him, but after 45 minutes of intense efforts, the patient could not be revived. So it is a common thing in medical practice that not every patient can be revived. What we can do is we give our 100% efforts to save them. Now the thing has happened is that once the patient was not saved, a mob of many people came and beat that resident, dislocated his shoulders and many things. Despite all of this, that doctor continued to work for the entire night, and in the morning he reported the incident and got his treatment. So this is not about one hospital or one college or one thing. This is about all of India. And I think stepping up the security, putting up the CCTV cameras, allowing one attendant with the patient, these are okay. These things are needed. But I think the root cause is not being addressed. The root cause is very simple. The general public has been lost in believing that we as doctors are here not to take care of them. We are here to loot them, that's what they think. And they have been misguided. The general public of India has been misguided by whatever they see on TV serials and movies and media and so many whatnot things you all know.
सर, हमारी मेन दिक्कत ये है, 250 किलोमीटर से मैं चल कर आया हूँ। सुबह 5 बजे इंटरसिटी ट्रेन पकड़ी, 11 बजे यहाँ पर आया हूँ, फिर यहाँ आया। अब ये कुछ नहीं हुआ, अब दिन भी बेकार हुआ और कुछ काम भी नहीं हुआ।
इनको ज़्यादा परेशानी है, कोई डॉक्टर देखने को तैयार नहीं है। अब यहाँ से कह रहे हैं आप ले जाओ, यहाँ से कहीं भी ले जाओ, हमें मतलब नहीं है, कुछ भी हो जाएगा आपके रिस्क के ऊपर।
इमरजेंसी में सर क्या है, इस टाइम कोई डॉक्टर नहीं है इस टाइम। अब कोई मरीज बाहर से आए, मतलब यहाँ इलाहाबाद से, मुरादाबाद से, लखनऊ से सब जगह आ रहा है, और वो ये लोग ये पूछ कर जा रहा है कि यहाँ से हम कौन सा अस्पताल जाए। उनको ये तक का नहीं पता है कि अस्पताल मतलब यहाँ के बाद कौन सा अस्पताल में जाना है, उन लोगों को ये तक का तो पता नहीं है।